days of surgery being our only option for rare eye diseases are over. Thrive Health Center Chicago is offering clinical trials and infusion treatments, minimizing the need for surgery for diseases such as thyroid eye disease. I sat down with the medical director and founder of Chicago Occufacial Plastic Surgery, Dr. Paul Phelps, to hear how this new innovation works.
TED is a thyroid eye disease, and it's on the rise because it's an autoimmune disease where the body attacks itself, and it's related to a lot of times stress. It can be related to genetics, the environment. Another thing that's really important in the causes of it is smoking. Patients who smoke, it really worsens thyroid eye disease. So there's so many factors, but I'd say now, April is Stress Awareness Month, and people are really stressed recently since COVID, I feel like, more than they were before. So stress is one of the main factors, I'd say.
I feel like, too, as people age, we've heard a lot more about thyroid disorders and more people having either hypo or hyperthyroid.
Yeah, well, so awareness, I think, is up, and there are a lot of factors that go into the thyroid levels, whether they be high, low, or normal, and they can change over the course of your life. And with the aging population as well, you do see more thyroid disorders with the aging population.
In TED specific, what would people see if they are starting to get TED or have TED?
Well, so great question. One of the most common findings is just dry eye disease. They feel like their eyes are really dry. One of the concerns that patients have often is their eyelid gets lifted up. That's called eyelid retraction. So it kind of looks like one eyelid's higher than it should be, or maybe they're bothered by the other eyelid that's a little lower than the one. So the asymmetry of the eyelids, or you can have bulging of the eyes or double vision where they're not lined up. Those are the most common symptoms.
And until now, it sounds like the treatments for this have been pretty invasive, if not at least somewhat frightening for patients.
Right, yeah, it sounds pretty scary, all the treatments. Yeah, it's like steroids, radiation, orbital decompression is the term for it, where we basically had to fracture the walls of the eye socket so the eye would move back into its normal position. Yeah, but now it's much less scary. So patients now can come in for these infusions. It's a pretty easy process, takes about an hour each, and you do 8 of the infusions. And oftentimes we're getting the same kind of results as we got with surgery. So
that's pretty amazing.
Yeah,
it's kind of a game changer for people.
I mean, many of the patients who I treat with it say it's a wonder drug.
Talk about Thrive Chicago. This is where a lot of this is happening.
Right. So Thrive Chicago in my office is brand new. It's a first and only practice in Illinois. And I actually had the first patient in the state of Illinois who got treated with Tepezza back during the clinical trial. So it's only been around for a short amount of time. But Thrive Health is great because the founder, Ray Douglas, he really helped invent this drug, and he's working with other companies, and we're working together to do clinical trials with other drugs that also improve thyroid eye disease. So now it's something that's much less scary, doesn't require going into the operating room, so much better for patients, and they're just so happy with the outcomes that they're seeing.
Because this is an autoimmune disease, is there anything people can do to try and prevent it?
Well, yeah, so great question. Prevention, there are a few things you can do. So one is don't smoke.
Okay.
Smoking, obviously, for a lot of reasons, is bad for a lot of diseases, and it's expensive. But for thyroid eye disease, we know that that worsens it. Also avoiding stress, which isn't always possible.
Yeah, right.
So, yeah. Patients don't usually react too well when you're like, well, stop being stressed out.
Okay, so now you're making me more stressed, so how do you do that?
Yeah, right. So, and then, eating healthy, anti-inflammatory diet doesn't hurt, but, exercise, diet and exercise are always go-tos.
But I imagine for folks, too, who this is kind of foreign to, are those like symptoms with your eye something that they need to come see you for?
Well, so typically patients with those early symptoms, so say they just had like dry eye or a blurred vision, they don't need to go to an oculofacial plastic surgeon like myself for those symptoms. I'd typically just go to, recommend that they go to the regular eye care provider, be it an optometrist or ophthalmologist in their area, and just get those symptoms evaluated. If they have, their eyes are bulging and one of their eyelids is pulled up, then it's probably time to come see an oculoplastic surgeon to determine for sure if they have thyroid eye disease, because there may be a treatment that we can offer them sooner than later.
Where do folks find more information about all of this?
Well, there's a lot of great resources. So Thrive Health has a great website. They can look on my website. There's some information about thyroid eye disease. The Oculofacial Society, which is the group of doctors that mostly manages this kind of disease. And then also, Horizon, which is a local company based in Deerfield. They have a lot of information about thyroid eye disease. They even have a TED Finder, so you can type in your zip code and find a doctor near you who treats thyroid eye disease.
Thrive Health is located at Chicago Occufacial Plastic Surgery on North Halsted Street. For more information on treatment and Thrive Health Center's infusion treatments or clinical trials, visit the website at thrivehealthiv.com. You can also call the number on your screen, send them an email, or follow them on social media.